Hi, it's Chris Byrd from WEX. This week we want to take some time to talk through how COVID-19 has impacted your existing benefit spending accounts and talk about how some new legislation can benefit you going forward. We've compiled a list of some of the top questions we're hearing, and so I'm going to address those now. The first question is, what changes can I make to how much I contribute to my benefit spending accounts? And I'm going to talk about several different kinds of benefit spending accounts in turn. The first are flexible spending accounts. In a typical benefit year, you're only allowed to make changes when you experience a qualifying life event. Now, due to COVID-19 and the pandemic, many are experiencing just such an event under their dependent care flexible spending account, either because their cost of daycare is decreased or, for many, because they are now working at home. Either one of these events allows you to adjust your contribution even down to zero. And then when daycare costs change again, as many go back to work, hopefully sooner than later, school and daycare, you can change your contribution again. Now, you may be wondering if you can change your election to your health FSA, the amount that's withheld from your paycheck every pay period. Particularly since many people can't go to the doctor or the dentist or the eye doctor for routine matters. Well, as of right now, the pandemic does not allow you to make a change in that contribution rate, although the Internal Revenue Service has taken the question under advisement. Let's move now to health savings accounts. Health savings accounts are privately owned accounts, and you can adjust your contribution rate at any time for any reason. As a refresher, the funds in your HSA are always yours. If you change jobs, the account goes with you. If you have funds left at the end of the year, those funds roll over to the next year. And all of the funds that you can contribute can be saved for future eligible expenses or retirement, particularly important at a time like this when, as I just mentioned, you can't necessarily go to the doctor. Those expenses will be there for another day. There is no use it or lose it with a health savings account. Because of COVID-19, however, the deadline to make 2019 tax year contributions to your health savings account, which would normally be April 15th, has been extended to July 15th. Finally, let's talk about commuter benefit accounts. We know you may not be commuting right now, so it's important to know you can make changes to your commuter benefit contributions at any time. The next question we're hearing a lot is, have there been any changes to how I use my healthcare accounts? Well, there have been. Recently, Congress passed a bill. It was called the CARES Act. And the nice advantage that was included in that bill is that it permanently allows you to use your flexible spending, healthcare reimbursement, and health savings account dollars to purchase over-the-counter medications without a prescription. And for the first time, to also purchase menstrual care products. This is more pertinent than ever because people are looking for ways to save money on out-of-pocket healthcare expenses. And so now things like pain relief medications, cold and flu products, and allergy products, as well as heartburn medications, and feminine care products like menstrual care products can be reimbursed pre-tax out of your account and save you money. Now, your healthcare debit card is a really convenient way to purchase these items. Over the next month, the retail merchants are gradually implementing the expanded list of products that includes these kinds of products that I just mentioned. So just be aware that there may be some locations in the near term where the card does not yet work for these kinds of products. But by mid to late May, the rollout among the merchant community should be complete. The CARES Act had one other provision. It also temporarily allows health savings account qualified insurance plans to cover any telehealth or remote care expenses, even if you haven't yet reached your deductible. And this change continues through this year and through 2021. The final question is, what kinds of virtual resources are available to help guide me as I work my way through these very challenging change times? Well, there are many resources that you can use to get the most out of these kinds of benefits. These include, but aren't necessarily limited to, your benefits mobile app or your online account. This allows you to do things like check your balance, file claims, request a distribution, or make payments, depending on what kind of plan you're enrolled in. Online shopping for eligible expenses is a great convenience, and it can be done on sites like Health Shopper, FSA Store, and HSA Store. These sites are all dedicated to items that are eligible for tax-free benefit account reimbursement, like FSAs and HSAs. And finally, many healthcare providers are now offering telemedicine. So even if you can't go to the doctor's office for those routine matters, check with your provider. They may be able to see you virtually. Thanks for listening. We hope this information was valuable to you. And most importantly, we hope that you and your loved ones are staying safe and healthy.